Kath Evans, welcome to Leaders in Focus. We're running a number of these interviews over the year, talking to very interesting leaders in various different sectors and marketplaces. And you have a fascinating role within the NHS, and probably a business card that's or has to be bigger given the job title that you have. Do you want to just tell us who you are and what you do?
Delighted to. Now, in the name of Kate Granger, the wonderful doctor who created Hello, my name is, I'll say hello, my name is Kath Evans. I've got a portfolio role, but what I would say is that I'm a children's nurse. That's my absolute core. But I've got the privilege of working at Barts Health in London as Director of Children's Nursing here. And I've also then got a role across North East London Integrated Care System, which means that we work with a number of partners for the whole of North East London, really as a clinical lead and champion for child health in its broader sense. I also dabble a little bit with NHS England, London region, where I'm a real champion for voice and participation and making sure that we are working directly with our children and young people, because ultimately it's them that we need to focus on so that we ensure that we create better health outcomes for them.
And I mean, our connection is Louise Grew of the Royal Dahl Children Nurses, and we'll come back to that a little bit later on. My connection personally is my mother, who was a Great Ormond Street nurse back in 1967 when she started. But tell me a little bit about your journey, because you started in Wales, that's right, in health services. So go back a little bit and give us a little bit of backstory.
Okay, because I'm really excited to tell you about my trustee role at the Royal Dahl charity. So I'm looking forward to coming back to that. So yes, I started doing my nurse training back in Cardiff, actually, in 1988. I have no idea where the time flies to. But one of the wonderful things about the NHS is that it creates opportunities. And as a young person, then I did my general nurse training. I had the privilege of working in Cardiff Royal Infirmary on Coronation Ward, the children's ward, where I very much learnt my trade. But actually I learnt that from a lot of support workers and healthcare assistants who were absolutely phenomenal. And I had the privilege then of coming up to Great Ormond Street, and I did my advanced diploma, and I did my degree and my master's in nursing, very much focusing on children's cancer care at that stage. That was tough. Great Ormond Street is the most wonderful place, but my goodness, the children really are incredibly unwell on occasions. And actually the support for families is just phenomenal there. But I did feel as though I needed to go back to general paediatrics and look after children with perhaps asthma, respiratory challenges, who actually get well and go home again. So I went to the Whittington in North London, went back to general paediatrics, and it was there I got involved in education, and I started working with universities and Middlesex. So Middlesex University very much had an inclusive widening participation agenda at that stage, which for me was really exciting. It was about helping our support workers pursue their careers and really grow and develop. So that was great. And as is often the way in the NHS, doors open. So I took up some programme management roles. I got involved in commissioning alongside education, alongside clinical practice, and finally went to the Whittington and went back to the Whittington as Assistant Director of Nursing. And that was a very broad remit. And then I had my little girl in 2003, and I had a telephone call from a colleague who said, "Oh, I'm working in Eastern North Hertfordshire," which is where I was based, in Welwyn Garden City. "Are you interested in being lead nurse for children's services? Would you apply?" So that's exactly what I did. And I learned so much in that role, managing acute and community children's services in Hertfordshire, but also after 5 years of being there, a national organisation called the NHS Institute for Innovation and Improvement, the phenomenal Helen Bevan, transformation guru in the NHS, was leading that organisation at that stage. And they were doing a programme of work around transforming children's emergency and urgent care. So I did that. I went off on secondment. And again, that's a great thing about the NHS. You get these opportunities. Went off on secondment, did a national role. And then, of course, NHS England came into being. There was a portfolio opportunity to focus on improving experiences of care for babies, children and young people nationally. I was successful, took up that role, did that for 5 years. And then I got a bit of an itch. I loved working nationally and all of the networking, but I wanted to come back to clinical practice. And again, a secondment opportunity came up at Barts Health. I came here for a year, working alongside my national role, and then they advertised the post permanently. So for the last 6 years, I've been at Barts Health, but that's quite a journey, Nick.
Amazing journey. I mean, what it shows is an organisation that is throwing up opportunities and throwing up the chance for you to second into different parts of the organisation. One of the questions I had was around, is the NHS still developing good leaders? And obviously we see a lot of leadership in what we do in our business, but there are lots of pressures, day-to-day pressures, mental health pressures, just the sheer weight of responsibility that sits on your shoulders. Where do you think the NHS stands from the point of view of sort of that continual professional development in terms of helping to develop and grow great leaders?
The NHS is full of phenomenal people at whatever layer in the organisation. So I've only actually got to walk out through Barts Health Corridor this morning to see fantastic volunteers. We've got amazing clinicians and we've got amazing managers and leaders. They are all around us, day in, day out, doing great work. Often in the press, we see a significant degree of negativity, but you've only got to walk through our hospital corridors to see that there are great people doing great things. And I think we need that connectivity and that reminder, because when I have the joy of actually walking through our wards, speaking to our families, using our services, there is nothing but positivity for the direct care that they are receiving. Of course, we've got many significant challenges to address, but I think that there are also parts of the NHS who are supporting the growth of leaders as well. I had the privilege of doing the NIBEVAN programme with the NHS Leadership Academy. That provided me with really helpful academic insight and credibility with regard to leadership development. But it also made sure that I had a network of colleagues all around me from outside Barts Health as well. And I think we all need that.
I mean, we talked previous call about the sort of what I described as the elephant. And it's such an enormous organisation. How do you, and you talked a bit about the sort of portfolio role that you lead. So how do you keep the ship moving forward in a way that is developing and changing and modernising?
And my particular focus is on improving child health. And that is an enormous elephant because there are so many different components, whether that be addressing the public health agenda in terms of immunisation uptake, whether it be thinking about the challenges related to emotional well-being, physical activity and how we actually increase that, or whether it be thinking about sort of clinical processes. And we've got 3 marker conditions, for example, in children's services that we're very focused on. So asthma, diabetes and epilepsy, and whether it actually be moving the health equality and equity agenda forward. There's a vast array of areas to focus on. But I think for me, one of the elements is that there are people behind all of those agendas, people in all different parts of the system working on those areas. How do we encourage, how do we nurture, and how do we support them in the work that they are doing to progress this agenda?
It's interesting what you talked about in terms of the NHS brand. And from personal experience, and I think this is, I would say, the vast majority of individuals' personal experience with the NHS, particularly around children's services, is when you have to step into it, it's amazing. And I remember our experience with one of our children at Luton and Dunstable Hospital, and the sheer volume of nursing care and support that came around a relatively minor issue. It was an eco-related issue, but nonetheless, it just was overwhelming, actually. And so, once you've connected with the NHS like that, or once you've fallen off your bike and had to rush to A&E or whatever it might be, I think that's really where the brand does itself the greatest justice. And of course, it's very easy in today's media, social media, and press for it to be sort of picked at around the fringes. Where do you see the brand standing now compared to the brand when you stepped into it back in 1988?
I think it's ever evolving. And again, that's down to the people who are the NHS. And I think we need to keep focused on that, whether it be our students in training, whether it be our really expert practitioners who have had very long careers. So I think it's always moving forward. Mm-hmm. And what I'm seeing more of is that real desire to work in partnership with other sectors continuing to grow. And I suppose just reflecting on your experience of using Luton and Dunstable, and the fact that we have a lot of clinical nurse specialists, mm-hmm. and the Roald Dahl charity, for example, has been phenomenal at supporting the growth and development of clinical nurse specialists.
Lovely segue into that part of the relationship between the NHS and, I guess, voluntary sector. I might be able to say that there's been a huge amount of pressure put on the NHS because of a lot of the support services potentially being reduced in the community, and therefore, more emphasis being placed on voluntary sector organisations stepping into that space. It does seem to be, if we talk about the Roald Dahl relationship for a second, those charities that support you seem to be not only enormously useful, but they also seem to be quite powerful in sort of pushing the message around actually how, from your stakeholder perspective, all of this needs to be joined up, and actually that connection with community needs to be joined up. And my experience with Roald Dahl is that's a lot of what they are out there doing on your behalf to some extent, but also in cohort.
Yes, yeah, and if I can just reflect on the difference that Dame Lissy Dahl has actually made, it's been absolutely tremendous, because not only have we now got 120 mm-hmm. Roald Dahl mm-hmm. nurses across the whole of the country, actually that organisation is providing a huge amount of continuous professional development for nursing staff as well, which is really valued. And because they're supporting all of those nurses across the country, you've got a lot of intelligence that's being picked up as well. And then charitable organisations such as Roald Dahl Marvellous Children's Charity are able to use that in terms of advocacy and influence. And that's really powerful and incredibly helpful for those of us who are practitioners within the NHS. We need all of those voices, whether they come from the NHS itself, whether it's from the voluntary sector, or whether it's directly from our children, young people and families, because they're incredibly powerful advocates too.
And is it possible to shape for the watchers and listeners the sort of scope of whether it's the number of people that you're responsible for within your role, in terms of the number of potential families or the universe that you're supporting?
Within North East London, we've got a population of 2 million people, really richly diverse, mm-hmm. but there's a significant amount of poverty. Up to 30% of our families are actually living in poverty. Now, 500,000 of that 2 million population are babies, children and young people. My absolute ambition is that we see better health outcomes, particularly in North East London. But if we can do it in North East London, actually, we can influence and we can spread good practice across London and across the rest of the country moving forward.
And we talked about the I guess the challenge and the intent of a patient coming into hospital and the speed at which you would wish for them to get back out into community care, community services. Can you talk through some of the challenges in that? What are the challenges that are potentially making that harder for you at the moment?
So whilst I'm a hospital-based children's nurse, I am incredibly aware that the last place that any child wants to be is in hospital. They want to be at home, in their communities, using their local playgrounds and actually interacting with their friends and their schools as well. So my real focus is on reducing length of stay and reducing hospitalisation at every opportunity we possibly can. Now, in order to do that, we have to build community capacity, but we also have to support our children and young people across pathways of care as well. And again, coming back to the role of clinical nurse specialists, for example, that's what they do so wonderfully. They can actually support children and families during that hospitalisation period, but actually then follow them out into the community. Because supporting a child with complex medical needs as they return to school is really challenging. The education team need those skills and confidence to continue to actually care for our children. Now, our clinical nurse specialists do that wonderfully, but it could be that it's also a voluntary organisation, whether that be guides, scouts, whatever. Our clinical nurse specialists will actually support that journey. And I think the more that we can not only work with our voluntary sector organisations, our primary care teams, our community children's nursing teams, as well as our hospital teams, we begin to grow and nurture that real focus on shifting care out of hospital back into communities, because that's what children say that they really want.
And we touched on some of the pressures. You mentioned poverty, but you also talked about housing, and obviously that's a significant issue. And it's not something you or I are going to be able to fix, but it is an enormous pressure.
It's a huge issue and something that we need to work in partnership with our local authorities on. And that's the joy of an integrated care system as well, because that's not just the NHS, that's very much working in partnership with local authority colleagues as well to tackle some of these really wicked challenges with regard to housing availability, but also continuing care packages as well for our children and young people.
What will success look like for you in 3, 4, 5 years' time? What will success compared to where we are today look like for you in your role?
I think there are a number of components to what success looks like moving forward. A critical component is workforce and making sure that we have people in place to continue to care for and with our babies, children and young people. So how do we grow that? How do we develop that? A lot of that is about our relationships with universities, but also thinking about exciting apprenticeship pathways as well. Ultimately, though, what I really want us to do is shift the dial on child health across the UK. When we look at some of our European colleagues, child health outcomes there are much, much better, whether that be mental health, whether that be obesity levels, whether that be outcomes relating to asthma, diabetes and epilepsy, whether that be reducing child mortality. We've got some big ticket items that actually in 5, 10, 20 years, and we have to be in this for the long term. And I think that's a challenge. This is not going to be solved in a 5-year term. This has to be a much longer focus in order to make sure that we create the very best society. Because of course, children are children today, but there are adults of tomorrow and absolutely deserve that focus.
The scope of responsibility is from 0 to 25 from the conversation that we had. And I mean, again, I don't think many people looking in from the outside, looking at children's and young people's services, would necessarily attach it to 25 years of age. So I mean, that just broadens that scope, and potentially the issues and the care required at that level are just as significant, and obviously are far more related to community care and community services.
Absolutely. And whilst our legal definition of childhood is 0 to 18, actually for those children with special educational needs and disability, and also those children who have actually been in care in care of the local authority, and that ongoing experience of having been through care really does mean that we need to be far more inclusive in thinking holistically about that 0 to 25 age span.
The one thing that's come across in our various conversations has been just there feels like such a level of personal commitment from you to what you're doing and the role, and a very natural, I think, energy in you. What drives you? What is it that drives you to get up, out of bed every morning and come into what will no doubtedly be another reasonably relentless day?
One of the things I've had a real joy in actually doing throughout my career is connecting directly to young people. And it's their stories and their experiences that really drive me. So there's one young man, Theo, who has osteogenesis imperfecta, or brittle bones. And Theo worked very closely with me when I was at NHS England, and we were doing a bit of lobbying actually. So we've got a national survey programme, and traditionally our surveys go out to all of our adults using NHS services, but we didn't have a robust survey programme in place that focused on what mattered most to children, what were their experiences. So Theo came along with me to a meeting with the great and the good, as is often the way, the Care Quality Commission and key influencers. And we had a really helpful conversation, as you usually do in these very formal meetings. But actually at the end of that meeting, Theo turned around and said, in my 19 years of using NHS services, and I've used safeguarding services until my brittle bones was diagnosed, I've used inpatient services, A&E services, nobody has ever once said to me, what matters to you, Theo? How does it feel to be on the receiving end of care? My goodness, that was a key influencing moment. We could have spent a lot of time talking about that agenda, but interestingly, after Theo's perspective, the Care Quality Commission went away, and every 2 years now we have a formal survey programme whereby we specifically ask children and young people, how does it feel to use hospital services?
Again, when we were talking earlier, you were talking about almost having children on your shoulder, that you sort of, in certain situations, you'll think about Theo or you'll think about another child and bring them to the front of, I guess, your conversation or your challenge.
Absolutely. And it's also about creating opportunities for young people to have their voices heard directly. So one of the things that, again, throughout my career, we've been able to do is create the NHS Youth Forum, group of young people, 25 across the UK, lobbying and influencing NHS England to keep focused on what matters most to them. And most recently, we've worked with care experienced young people. They said, Kath, we haven't got the bank of mum and dad to draw on if we need a prescription. And we've got to weigh up whether to pay for our transport to work, whether to pay for our rent or our food. How can you work together and make sure that if we need a prescription, that will be funded for us? And I'm absolutely delighted to say that with 5 ICBs across London, we've put that in place for London, which is really, really fantastic.
Brilliant. It's an obvious question, and it's probably, I slightly know the answer, but I think it's important for people to understand. I mean, we were connected through Roald Dahl. It wasn't a mistake, but I put my hand up and somebody said at a lunch would I run the marathon for them, which I did and thoroughly enjoyed. Then I found out that you do ultra running and ultra marathon. So the question was around sort of what do you do to, I guess, unwind, clear the head, and what was it about running, and how did that lead into ultra running?
Importantly, can I just say congratulations on running the marathon, and importantly for raising funds for Roald Dahl, which is really, really fantastic because we directly see the benefits from that. So thank you. We all need a bit of headspace and we all need a bit of balance. And for me, being out in nature and trail running provides that. Now, I am not fast. I suspect you were incredibly speedy with your marathon time. But the joy of ultra running is that you don't have to run all of it. Now, that's a bit of a secret, so don't tell everyone that, because everyone will be ultra running. But just this weekend, I was down on the Welsh coast and covered some distance from Penarth down to Ogmore by sea. Storm Kathleen blew me along the way. There was an awful lot of mud, but my goodness, it was a huge amount of fun as well. And just that fresh air just allows the brain to tick over, to reflect.
There's something about that sort of, I'm just thinking it's that sort of 3 to 5 kilometres in where all of the noise suddenly starts to kind of dissipate, and you can begin to almost sort of, the way I see it was you began to see one thing through at a time in your mind, which is. But what was the step between going for a 5K to doing a marathon to then somebody saying, well, tell you what, why don't you go and do 100 miles or 100 kilometres?
I'm not quite there on 100 miles yet. I wish that's an ultimate ambition. But again, I think sort of just getting going with Parkrun, which is a phenomenal initiative. We've also got NHS 1,000 Miles, which is a fantastic community that post every Sunday evening at 7:30 what they've been up to and their miles. We've been running that actually since the NHS's 70th birthday. And then connections with people. A colleague who I was running alongside said, oh, do you fancy doing a long distance walking association event? And one thing often leads to another. So I think there's something about a motto for life there. Actually, you need to expose yourselves to these opportunities, don't you?
Yeah, and it's the sort of it's the as physically fit as you can be will give you, I think, the greatest mental health as well. So.
And I don't think that we can underestimate the importance of looking after ourselves and that self-care element and trying to be as fit as we possibly can be. And of course, everyone will vary, whether that be a bit more walking, a bit more cycling, or even a 5K or an ultra run. Everyone's different, but I do think we all need that headspace.
I'll ask you one more question just around mental health, because there's arguably an epidemic at all levels. I'm just interested to know from a child services perspective, is that something that is now top of the agenda? You talked about obviously the 3 pillars that you're focused on, but I just wonder how and where mental health is playing into your role and the daily conversations you're having as leaders.
And that real focus on mental health is, again, a critical agenda item. One of the things that we've been testing in secondary care is the presence of a social prescriber. And we've tested that thanks to Barts Charity. They gave us some funding to do that for our children and young people who've got sickle cell disease. But generally very good in the NHS at focusing on the clinical condition rather than thinking about all those other elements that make a huge difference to young people. So the input from a social prescriber has really allowed us to focus much more holistically. There's one young person, for example, whose absolute ambition was to get on a bus and go to the local library. Well, the social prescriber was able to do that with them. Now, the impact that those types of interventions has on somebody's emotional and mental health are significant. So I think that we are beginning to think much more holistically, but we need to do more of that. And also, if I just reflect on the Roald Dahl, Marvellous Children's Charity, again, that's what they do so wonderfully, provide that support for families as well as for children that think really, really holistically about that agenda.
Kath Evans, thank you very much for your time. Really enjoyed the conversation.
Thank you, Nick. It's been lovely to chat with you.